Dr. Michael D'Andrea, and we are having another version of Taking It to the Streets. We're in the streets of Milwaukee, Wisconsin, and we have the honor of working with two people tonight that we hope stimulate your thinking about the racial healthcare gap, alternative healthcare procedures and services that are available to everyone in the country, but for a host of reasons that we'll learn about tonight, are oftentimes not utilized by African American persons in particular. Tonight we are delighted to have someone whose expertise is broadly based, and that's Mrs. Sabrina Folks-Thomas.
Thank you.
Sabrina, so nice to have you here.
Thank you so much.
And we have Ms. Kara Pitt D'Andrea. Both of these women are involved in the healthcare system in Milwaukee. And do you want to give a little bit of insight to the audience about who you are and some of your background?
Yeah, sure. So I currently am working as a doula. I've been a doula for the last 10 years. A doula, for those who don't know, is another woman, typically, that is providing a service for a family unit for a mom that is about to have a baby. Our background is we usually are providing prenatal education for that mom, and our whole role and responsibility is to advocate for that family, to empower that family, to help them understand the choices that they have in bringing forth a child, whether they're choosing to birth in a hospital setting, a home birth setting, a freestanding birth center. So we help them just, educate them to empower them so they have the choices. We usually develop something with them called a birth preference guide, or some families would call it a birth plan. Again, it's just outlining things that is important to them. We usually do about 2 prenatal visits with each family, again, education-based. We're helping them with breastfeeding support after they have the baby and education prior. Childbirth education is also a part of it, as well as incorporating their partner into this so that the mom can feel empowered as a unit bringing forth this child. Because we know, statistically proven, that the more that a family knows about what is happening to their body and what is happening, the choices that they have available to them, they can make more educated, informed decisions and ultimately have a healthier pregnancy, as well as just a healthier environment and a postpartum. So we're also there to help women with things postpartum and to be just another support and advocate for that family. So I've done that for the last 10 years in the Milwaukee surrounding area. I originally, after about 3 years of being a doula, I started a doula program in one of the inner city high schools, North Division High School, and primarily my focus was to work with young teenage moms that were pregnant and to meet them where they were, not to judge them, and to help integrate the fathers into the picture so that we were blending these units and we weren't dismissing these fathers, but to help them realize, I'm pregnant now, okay, and to move forward with that and make healthy decisions for their baby and for themselves. So I did that as well too. I also have a background as a private practice lactation consultant, which is basically a big word for a woman who helps somebody else with breastfeeding education, and kind of counseling them. I've done childbirth education as well too, which is just helping women and families understand what's happening to my body and what can I do when I'm in labor. I also just recently finished training as a home birth midwife, which is a woman or a midwife that delivers or assists a mom outside of a hospital setting. So we don't work in a hospital, but we're outside of a hospital setting. I have a nursing background, which I feel complements that as well too. And I do something that's kind of interesting that many people may not have heard of, but it's called placenta encapsulation. It's where we take a mom's placenta, we turn it into a powder form so that it is something that in this area of the world that it's a little bit more palatable for us, but ultimately it helps with postpartum blues, it helps a mom with milk supply, and ultimately it helps her with the normal hormone imbalances or rebalancing of your body after you have a baby, so that it decreases susceptibility to postpartum depression.
And we've talked a little bit about the changing role of mental health practitioners, moving beyond just an office-bound service provider. doing individual therapy and counseling. And the movement is expanding the roles of practitioners. And among the roles is a person who has the capacity to do a lot of outreach to
Correct.
at-risk groups. And the other important role we might talk a little bit in our conversation tonight is the role of advocacy.
Mm-hmm.
And you seem to really embody both
Mhm.
outreach and advocacy. And we may talk a little bit about it later in our conversation, but you did an awful successful job that was very challenging with the hospital and changing policies. Can you briefly describe that and give the audience an idea of the sort of advocacy that can be implemented?
Yep. So one of the biggest things is advocacy, like he was saying, and educating. And I feel like some of the things that we do, or some of the things that I do, are not, people are not aware and outside of the norm. And one of them was placenta encapsulation that I mentioned earlier. And one of the local hospitals that I frequent quite a bit, where people hire me and I service them as births, hired me to do placenta encapsulation. It was Sinai Hospital, Aurora Sinai Hospital here. And there was a mom who wanted to use me as a service for placenta encapsulation. And the hospital would not, though it is legally allowed for a mom to take her placenta out of the hospital and do whatever she wants to do with it, whether it be for, the purpose of turning it into capsules or for something religious based.
Mhm.
It is her right. But the hospital, for a lack of education, I will say, wanted us to not do that. So they pulled all their hardcore strings all the way, to saying that it was unsafe, unclean, and that they could be sued for it. So I sat in the hospital for about 5 to 6 hours with this mom. She was 24 hours, not even 24 hours postpartum. So this mother, African American mother, had to say to the, and I can backtrack and say that I have not had this situation happen with any of my Caucasian clients at all. But when she said the reason that she was wanting to take her placenta home, a bunch of stop blockers came up and they said they would not allow her to take it. So she had to say that she was going to leave the hospital before 24 hours for us to get any kind of headway. I had to end up contacting the CEO of the hospital, as well as a dear friend of mine that's a nurse midwife there, just to get attention for them to allow us to take this. This established or implemented a new policy with Sinai Hospital where we are now allowed to take it out of the hospital with no, interjections, interference at all, which I truly appreciate. But what we had to go through that day for a mom to have just had her baby and have to deal with an unmounting load of stress that was unnecessary is disheartening for me. But thankful that something positive came out of it for future families.
And the constitution of the placenta itself provides innumerable
Yes.
health promoting outcomes. And so from a social justice perspective, as you said, this never occurred with Caucasian clients that you've worked with, but in this case, it certainly, the racial factor would seem to have stood out as a barrier going on here. And that's a really concrete example of advocacy. We're going to talk more about the overlay of racial barriers and also how people perceive you as an African American woman. That's different from how Kara is perceived. Kara, why don't you introduce yourself a little bit to the audience here?
My name is Kara Petiandria. I'm currently most active as a childbirth educator. I have a very similar background to Sabrina, except that my background is Eastern medicine based, where hers is Western nursing based. We both do childbirth education. We both do lactation consultation. I have what's considered sort of the bachelor's degree of lactation, where hers is consultation, where hers is considered the master's degree. So I have a CLC and she's an IB-CLC. I have 7 years of doula experience and she has 10 years of doula experience. And I have no midwifery training, where she has completed the midwifery program. My experience in childbirth education is a little more extensive in that I have full-time taught for the past 5 years, but that is also a qualification of hers. And so my role as a parent advocate and family advocate and birth doula, which is both of our primary employment at this moment in time, is equivalent to one another. And so I work to ensure that parents have the outcome in their births, or at least the psychological understanding of the process of their birth that they've had, which in America is significantly undervalued in terms of how we involve families in their medical process, particularly in birth, which is the only physiological process aside from physiological death, which is death due to old age or natural causes. Birth is the only natural process occurring in Western medicine, which is very important to understand in our role, which is that we provide general recommendations to a process that is supposed to happen, but happens within hospitals.
Correct.
Unique to any other medical condition or process. And pregnancy is not a medical condition, although it is treated as such. And so what we spend our time doing is a lot of the education, advocacy, and helping parents to navigate the medical system in this condition that is not an actual medical condition, but a physiological condition and necessary condition to promote
Correct.
life. My background myself is that I have a bachelor's of sociology from the University of Maryland, a bachelor's of nutrition from the Midwest College of Oriental Medicine, and a bachelor's of Oriental Medicine from the Midwest College of Oriental Medicine, specializing in a thesis in postpartum maternal recovery, combining Eastern and Western medicine. So the journey has been over the past 7.5 years that I've been working through this. And Sabrina and I started working together about 4 to 5 years ago, and have very similar personalities, which is why that relationship works, for one another to work together in the healthcare
Yes.
field. So you need that continuity of care, which is what doulas provide.
Correct.
You know, I think the audience would benefit from, we can look at gender issues, we can look at socioeconomic issues, we can look at racial issues. They all seem to kind of meld together. But let's start off with, why would it be important to have these alternative healthcare services made available and accessible by all people in our society, especially persons who are underserved, like African Americans? Why is it important? I mean, what are the benefits of these services?
I would say first and foremost, these services particularly focus on the person as a whole. It's inclusive of the family altogether. Offering doula services to a family who hires you for your services, whether it's volunteered or paid or private, there's statistical research that shows having a doula, not even one that has this ultimate certification, but another woman that is just with you from the time that you go into labor, from the time that you deliver your baby, literally reduces interventions in any setting, whether it's hospital, like I said, out of hospital, or freestanding birth center. Those interventions or things that I'm speaking of particularly are decreasing C-section rate. 1 in 4 women are known to have a cesarean in the United States. 1 in 3 Black women are known to have a C-section. And it's unfortunate for me to say that it is not medical reasons that these women are having C-sections. And that is huge. So if we have another person there with them that is not speaking for them, but helping to educate and empower them so they know what they're up against and they can make informed choices when a doctor or a midwife is suggesting things, whether it's something they agree with or not, this helps to change the lives of how our babies are born and what they're susceptible at birth. Also decreasing, like I said, C-section, decreasing the use of pain meds as well during birth, and decreasing the use of intervention of Pitocin. So Pitocin helping to stimulate a labor. So we suggest things to help labors start naturally on their own, because we know that a labor that is started naturally, physiologically by the mom's body is better for that mom as well as that unborn child versus using any type of drugs or medications. So we're not against those interventions. We just hope in all families, no matter the race, that we can help decrease those, because we know decreasing them ultimately proves to have better outcomes for that baby, because it is a conscious being and there are things that are happening that does affect the baby. And a lot of times in Western medicine, we focus on the mom so much and not realizing what we do to the mom ultimately affects that baby as well too.
So having options
Yes.
available and be
Correct.
knowledgeable of those options. You know, counselors and other mental health professionals are being urged to implement preventive interventions. And what I've heard you say here is that the doula, the presence of a doula through the labor process, the birth process, has been proven through research to reduce cesarean sections.
Yes.
It's kind of astounding that 1 out of every 3 black women who have children have a cesarean. You talked about reduced use of pain medication. You talked about reduced use of Pitocin, which is to stimulate the
Correct.
labor process. And these have longer term benefits for the mother.
Correct.
How about the child, the infant that's born? What sort of benefits do you think a doula, these alternative healthcare, has for that next generation of people who are brought to life with doula services?
Well, I can say, if I'm touching on the question correctly, just my opinion in general is I truly feel, and I'm not against medication, I'm not against epidurals because I feel like there's times when they're necessary, but I feel when a mom, whatever the race is, has a conscious effort or is consciously a part of her birth. So there's women who go into the hospital and just choose to have an epidural, and that's fine. That's okay that's how they want to do it. But particularly speaking to women of color, when you can consciously be a part of that birth and consciously be a part of that effort and those and the decisions and the choices of having your child, I truly feel that it starts your conscious effort of parenting at that moment. And it changes how you feel about that child. And what I mean by that is when you are able to feel exactly what you're going through and know that you're a part of those choices. So I've worked with women who say with their first baby, I feel like everything just happened to me. I feel like the nurse came in and she did her job, but I didn't have a right to say what I needed. I felt like the doctor made choices and I didn't have any clue what was going on. I didn't know. And when they walk out of their next birth, however it may have happened, when they have an impact on their own birth, whether it went to a C-section, they had an epidural, or they had a natural birth, whatever it may be, it consciously changes how they bond with that child as well too. And we know, just working with women, that bonding skin to skin is something that's huge that I try and educate a lot of people about, which is your body being, bare next to your baby's body. That is 90% of brain development for a newborn child in the first year of their life. So it's just things like that seem so in the medical world, minor, but they're so huge in the conscious being of an unborn child, and then when they're born. So
And
I would like to say too that in terms of the conscious development of the child, is that we know that when parents feel connected to the birth experience, they reach out more to the infant themselves, and that those children are responded to based on the child's and the infant's cues, and that the communication begins from the day of birth, and that when the parents long-term express a dissatisfaction with the birth experience, there tends to be a disconnect. Now, whether or not the long-term effects are tangible for the child is questionable, but for the parent is unquestionable. And we have linked continuously postpartum blues or postpartum depression continuously can be a sustained period of time that counselors find has been over 5, 7, 10, 15 years. And then when you look at the child's security, when they gave up blankets, when they gave up different coping mechanisms, can be linked to the bonding experiences of the parent. When we teach parents to trust their instincts, which we know, particularly maternally, not
second
as
guess.
much paternally. The paternal instincts have a slight variation, but maternal instincts in terms of coming to their children in the night, we know it decreases postpartum anxiety. We know that answering your child in the night or in their sleep patterns decreases infant anxiety. We know that it decreases the need for pacifiers or other aids, and we know that sleep isolation is not healthy for children. So we'd like to see them at least in the same room.
Close proximity.
And close proximity. We know this from birth mothers, birth fathers, foster parents
Correct.
of infants, and any care provider bonding. And we know this from James McKenna at the University of Notre Dame, who specializes in sleep patterns of newborns.
Correct.
So, you know, the two terms that come to mind with the mental health professionals that are viewing this version of taking it to the street is something you just said, Kara, which is bonding, and how the bonding process begins actually before birth.
Correct.
The bonding
Absolutely.
and connection. But then the significance of the birthing process really
It's a huge
a
impact.
huge impact in terms of bonding. The other is the theory of attachment. And most practitioners are very familiar with the work of John Bowlby and Mary Ainsworth and the process of attachment and its long-term effects, as you were saying. By the way, I thought your comments about looking at the sort of care, whether it was more traditional versus the doula service, would be a great master's or doctorate thesis to see how long-term impact on the infant through childhood, through the first 10 years would be a great research project. But what I hope the audience is getting from our conversation here is that the attachment process is part and an extension of bonding,
Correct.
Absolutely.
and that it really needs to be looked at as a social justice issue.
Yes.
Because
Yes.
without the sort of options that
Correct.
provide a healthy, a nurturing, a more effective bonding, the attachment process is going to be disruptive.
Correct.
And I think the research that you talked about is about the responsivity of mothers who have more natural processes in birth is significantly different than persons who go through cesareans or
Yes.
have medication that is literally anesthetizing their experience and connection with the child. Why African American teenagers or women in general? Why the emphasis on this particular group in our society in terms of increasing the knowledge and advocating for the opportunities to access doula services and other related services?
One of the main reasons that it really has struck my heart in doing this is because I've looked at, particularly in Milwaukee, the infant mortality rate of our African American babies, and looked at its association with the care that women are getting, the type of care that they're getting, the prenatal care that they're getting, as well as not breastfeeding. So that is another concerning issue among women of color, is the lack of education and information surrounding breastfeeding. And truly, breastfeeding does, speaking specifically to women of color, save lives as well as change how the baby is growing, and changes the susceptibility to different illnesses for this child. And being a woman that is African American, I am very much aware of all the things that we are susceptible to. So it decreases asthma, ear infections, heart disease, cancers in children, as well as in the
Mothers,
mom as well
absolutely.
too. And a lot of this, I feel, comes from lack of education. It's not that women of color do not want to breastfeed their children. A lot of it is
Support in the
the support in the community, stigmas surrounding it, lack of education, and then other things that are more burdensome to them during that time that they're having their baby. For instance, a typical mom that is Caucasian might have 6 to 12 weeks off from work, where a lot of the women that I have worked with have to go back to work at 2 weeks. So in their essence, they're like, I'm not really worried about breastfeeding because I have to go back to work to provide for my other children, and I don't have anybody to watch my child, or time to pump on my job, or I could get fired for trying to pump on my job. So there's very many deep issues that I'm trying to take a look at to help support these women, educate these women so that they can empower themselves moving forward. But first, there's so many other barriers below that surface that need to be addressed as well too.
And the other problem that I'd like to address in Milwaukee and cities similar to Milwaukee is that when you have the significant segregation within schools, and you have then the populations such as my children attend, which is a lot of attachment parenting, which is breastfeeding, skin to skin, long-term mom stay at home, and you have that development, and the brain develops in a way where it understands its basic needs are met, and therefore can exceed those needs and go into additional educational learning opportunities. And then you have the schools in the north side of our city, which are predominantly, if not exclusively, non-Caucasian, if not exclusively African American. And what you have in those is the mothers didn't know their rights in the birth room, and the babies were taken away, and they have attachment disorders, and they have additional traumatic events happening at home for a variety of reasons, not exclusive to, but including postpartum blues and postpartum depression to a higher degree, undiagnosed and untreated and uncared for than the Caucasian mother.
Now that's research-based, the disproportionate number of
We have
color?
research to support it. We have research to support it.
And could you say those points again that stand out, the postpartum
We
phenomenon?
know that mothers who don't know their rights are less likely to request their infants stay with them and receive exclusive breastfeeding. We know that those infants who are less likely to stay with mothers and less likely to receive exclusive breastfeeding are more likely to be taken away from their mothers because they believe, and mothers should have the ability to rest, but their babies should be brought back to them. When mothers are not informed of the importance of the frequency of breastfeeding, there's a decrease of breastfeeding and a decrease of the skin to skin and attachment bonding period. When those children are introduced to long-term stresses in addition to being detached from thank you, from the beginning,
Correct.
we see a heightened stress, elevated cortisol levels in those children.
Sustaining.
That's sustaining, which we know affects brain development, heart
Attention.
disease, attention deficit disorder. And then, at least in the city of Milwaukee, we have mostly those same students in the same schools. Now, fundamentally and statistically, if you look at what supports a positive education experience, we know statistically the only thing that has worked in America is the integration of the students who are not of heightened stress environments, which in Milwaukee is predominantly non-Caucasian and African American students. And we know that you need to integrate those so that they understand the safe feeling, the ability to learn more, this is a safe environment. So what happens with our students is that we lump all of our stressed, underserved population into one room, and what the teachers are serving them is daily functioning more than an accelerated learning environment. So now this started at birth. This is our work at birth, and we're saying have the skin to skin, elevate those oxytocin levels.
Because we know the long-term
We know the
effects.
long-term benefits. We know they will miss less school days. We know they will be less stressed. We know that you will have less likelihood of depression, which will affect your children. We know that statistically. And when that doesn't happen, when the system fails those women and then fails their children, and they're put together in the same school system, and then it perpetuates this cycle.
You know, I'm thinking of three other terms that mental health professionals are aware of. You're talking a lot about educating and supporting women, and it leads to their empowerment, both individual and collective, among different races. So the empowerment process comes in. And, you know, a kind of a more gentle term is the racial healthcare disparities. But what you're really talking about here is large numbers of people who are getting different institutionalized services and care according to racial identity and background. So we're really looking at concretely defining a term that many counselors and allied mental health professionals have with understanding institutional racism. And everything that you're saying here with the disproportionate number of African American mothers not having the educational services, the support
Correct.
to at least understand their options
Correct.
that are proven through research to have long-term benefits to them and their infants,
Correct.
as well as what you were talking about, Kara, which is this high anxiety level kids who are largely African American in ancestry
Absolutely.
compared to predominantly white schools. So this really helps the audience, I think, understand if we can name it as institutional racism.
Yeah.
It really begs for us to become more social justice advocates in this regard. You know, we've been talking about the benefits and the barriers to the women and to the infants that are born, but you two have an interesting set of experiences with your own racial experiences. And I know that, Carrie, you have talked about Sabrina's experiences. You've talked about, I wonder if we could talk a little bit about healthcare professionals, one a Caucasian, one an African American, and the different type of experiences that you experience and that you feel that you have to provide to legitimize what in this case seems to be increased level of education in doula and training than yourself. What sort of racial issues have you two experienced in this regard as professionals?
I'll let you go.
Yeah. It's a little harder for me it's a little more upsetting for me to talk about. So I know that in our mutual field, all things considered equal, is that Sabrina has a superior, not only in her education level. I don't believe that just because you have more education makes you a superior provider.
That's a good point.
But it is not only in her education. It is in that she has a step above me in each level that I have. So I have a CLC certified lactation consultant. She has the international board. It means that she sat for a medical board exam. She has more than 1,000 hours observed that she had to participate to get this degree. She has done extensively, vastly more work than me to get that. And she has her nursing degree and she has her midwifery degree, and we both have a master's degree of sorts in my oriental medicine degree. And where it starts to get hard to break down is when we're both in the same hospital, or where we often will do support work for one another and backup work for one another, because our personalities are very similar. And this is what I tell people. If she shows up to your birth because I cannot be there, you won't be able to tell the difference in terms of our support. We have the same fundamental values. We will communicate with one another extensively. But the way in which we go about having to prove ourselves was not made apparent to me until about 24 months ago in a conversation that she and I were having, and in a couple of experiences that I've had with hospital staff, where most of the nurses in our community are Caucasian. And so I think that their identity or their ability to identify with me is easier. And so at the particular hospital that we were mentioning earlier, which is a local hospital where Sabrina sat down and created with the administrators of the hospital an entire, and which I think you failed to say earlier, is not just the acknowledgement of a woman's right to have her own placenta at birth, but the legal obligation of the hospital in a form status. There is a legal form that was created by Sabrina. And this nurse said to me, "I know you. I've seen you before." And I said, "No, I don't think you know me." And she said, "No, you're the one that created the form. You're very nurse friendly." And I said, "No, the woman that you're referring to is nurse friendly because she has a nursing degree and she's African American." And I think that the credit that I get, even from your efforts, is immensely pronounced in this community because people like you, you have a very well educated stance and platform, and they assume it wasn't you. And there was a conversation that we were having that kind of blew me away, where you said to me, I'm not upset. You said this to me. I'm not upset with you, but to be clear, anything you do, I have to do twice as good as you to get an ounce of the credit that you get. And I was raised with that understanding, but it kind of blew me away, and I thought, that sucks so much, So we see that, and I have to say, in the city of Milwaukee, with this segregation, as doulas, we consider ourselves lucky for fairly progressive healthcare providers in terms
Correct.
of education, supporting us. We have a very good foundation with no less than 12 to 14, off the top of my head, healthcare providers and hospital-based midwives that we continuously draw on, and they continuously support us. Given all of that, when they are eliminated and we're with the general population, if Sabrina and I were put in the same room and the credentials were provided, they would surely select me with the higher credentials, purely based on racial subconscious identity.
How about your own experiences with being an African American woman and encountering white privilege in its different shapes and forms?
Well, I definitely can say just from Kara's platform of what she just said, being in the hospital, that for the most part, very fortunate that we have several providers that are very understanding and very supportive. I had, like I said earlier, been a doula for 10 years, and I truly feel like anybody would have to work hard, that it's taken quite a bit for me to get recognized by the medical staff, particularly the nurses, because that's who we frequently see quite, the most when we're at a birth outside of the doctor, that I am qualified, that I am educated, that I know what I'm talking about. And a lot of times I find, unfortunately, that in order to get any type of acknowledgement from the medical staff, particularly the nurses, I somehow have to, through conversation, let them know that I am a nurse, in order for them to show me any type of respect, is the best way to put it. I've had doctors that have flat out not really spoken to me the entire labor, and then later on found out credentials from either the mom or that nurse shared it with them, and then they're willing to have the conversation with me afterwards, or after the birth, or now I would like to refer you because I realized, so and so and how you acted. When Kara spoke earlier about how I feel like as a black woman that I have to work 10 times harder than she does, again, like I said, I'm not angry at her for that. It's just, unfortunately, again, that institutional racism that I've realized is there and present, regardless.